Now, the Nigeria Center for Disease Control have confirmed 245 new cases of COVID-19 in the country. The agency made the announcement on Monday night via its Twitter handle, confirming that Nigeria now has a total of 2,802 confirmed cases of COVID-19 in 34 states and the Federal Capital Territory. Of the 245 new cases, Lagos has 76, 37 are in Katsina, 3 in Jigawa, 23 in Kano, 19 in the FCT, 18 in Borno, 10 in Edo, 9 in Bauchi, 6 in Adamawa, 5 in Oyo, 5 in Ogun, 1 each in Ekiti, Osun, Benue, Niger, and Zamfara. 17 more persons were also discharged, bringing the total tally to 417 recoveries, while the number of fatalities has unfortunately increased from 87 to 93. So, Doctor, we've seen our largest daily rise so far since the first index case was confirmed in Nigeria, which is rather scary. And the Presidential Task Force is now focusing highly on Kano, as we already know. So what is your take? We'll assess all of this. What is your take on this?
Well, first, let me start with Kano. I think it's, enheartening that at last, the governor of Kano State is no longer in denial.
Yeah.
Because yesterday there was an event in Kano, which was the inauguration of the mobile testing facility that had been provided for Kano State by Alhaji Aliko Dangote. And I think Alhaji Aliko Dangote deserves commendation.
Certainly.
Not because he's from Kano State, but because he's been in the forefront of this fight against COVID-19 in various parts of Nigeria and also within the private sector itself. So, and incidentally, that mobile testing facility was is going to be managed by 54 Gene, whose CEO was on this program just about, a few days ago. Now, at that occasion, Governor Ganduje said, Kano is in trouble. And that's an admission, clearly, that the state government has brought into the narrative by the Presidential Task Force that indeed 80% of the cases of death that have been recorded recently in Kano State have to do with COVID-19. What remains now is for Governor Ganduje to cooperate more with, the WHO that has its officials on the ground, the Center for Disease Control, and the Federal Ministry of Health to see how testing can be ramped up in Kano, and people can be better sensitized and enlightened about the risk of COVID-19. Because Nasi Guazo, who was the head of the Presidential Task Force to Kano, has said the people of Kano themselves must begin to take COVID-19 seriously.
Absolutely.
Now, one other development yesterday that I think we need to underline is the complaint by the Director General of the NCDC about how people responded across the country to the relaxation of the lockdown. I mean, people were suicidal yesterday, as your introduction pointed out. All the banks were, filled with people. An
absolute mess.
Buses were filled to capacity. People did not observe social distancing. And Ihekwazu's concern is that if Nigerians continue like that, then the government will have no option but to ask people to go back and stay at home. But this morning, I could see that in Lagos, in the early hours of the morning, there wasn't that rush that we saw yesterday. Let us hope perhaps that what happened yesterday was just the enthusiasm of being released from lockdown, and that going forward, people will behave much better. They will realize that they do not have the right to commit suicide.
Absolutely. But there has to be compliance as well from the banks and other organizations as well that know the guidelines that are put out by the NCDC, know that people should be wearing masks, know that people should be practicing physical distancing, yet they still allow for it to happen. I'm sure a lot of banks will fix up today on their approach towards people coming to use their machines, etc., because yesterday was a disaster.
Well, the problem with the banks, as was pointed out at the briefing yesterday, was that many of the banks did not open their branches. Some of them just opened a few branches, and hence you had this rush in the various banks. So I think it's important for organizations, corporate organizations, businesses also, to cooperate with government. And one way in which they can cooperate with government is to just follow the guidelines. And then talking about the banks, one of the things I observed yesterday, was that in some of the banks, if you didn't have a face mask, they would not even allow you to enter.
Which is
if you managed to get to the top of the queue. Now, some people who did not have face masks, they were borrowing from people. People need to be told that you can't ask somebody to lend you, his or her face mask. I mean, that's like committing suicide. Yeah. People were lending each other face masks, and then they will use it to be able to gain access. That defeats the entire purpose of what government is trying to achieve.
But this is why government as well has to be able to enforce the guidelines that they put in place, because unfortunately, there's only so far that you can get when it comes to educating the populace on the right things to do in terms of COVID-19. So the only way that people are also going to be able to put it into action is when we see enforcement on the part of the government.
Meanwhile, the Minister of Information disclosed yesterday, if it may serve any purpose, that the Chinese doctors have not only all tested negative, they are now in some of the isolation centers trying to set up the equipment that they came with, and that they are also, doing capacity training together with their Nigerian counterparts. And he assured everyone that those 17 Chinese experts will not treat Nigerian patients. And you recall that that was the concern of the Nigerian Medical Association.
Absolutely.
So it will look as if, they've been able to meet each other halfway. And all that controversy about bringing Chinese experts in, Chinese doctors in, will seem to have been resolved.
Absolutely, because that was the biggest worry, focusing on the fact that are they coming in to treat people because they cannot if they're not registered doctors in Nigeria. So it's good that that has been cleared up. But let's see if there are still some problems that exist when the chairman of the Nigerian Medical Association comes on the show in a bit to discuss with us. Let's get his analysis on what they think about the developments that we're getting.
He's not the guest today. The guy that's coming today is the chairman of the Lagos NMA.
My apologies.
Dr. Hussaini.
My apologies. My apologies. Should we take another story?
Okay, well, there's still time.
Okay. Now, latest data from the Nigeria National Bureau of Statistics, the NBS, shows that 40% of Nigerians, about 83 million people that is, live in poverty. Figures published by the Statistics Office on Monday showed. The report on poverty and inequality from September 2018 to October 2019 said 40% live below a poverty line of 137,430 naira per year. In other words, on average, 4 out of 10 individuals in Nigeria have real per capita expenditures below the amount. The highest poverty levels were in Sokoto, where 87.7% of the people lived under the poverty line, compared with 4.5% in Lagos, which was the lowest rates. Now, according to the NBS, 52% of the people in rural areas live in poverty, compared with 18% in urban parts of the country. For safety reasons, the statistics did not include Borno, which has been worst hit by 10 years of Boko Haram insurgency, which of course is a concern, Doctor, because the reports didn't include Borno State, and it is stated that a total of nearly 8 million people need humanitarian assistance across Borno and 2 other states. How do you react?
Well, I mean, there isn't more time. Let's take a break. Maybe when we return, if there is time, we can then deconstruct this report.
Definitely. Stay with us. Welcome back. You're still watching The Morning Show here on Arise News. Now, Doctor, before we went on a quick commercial break, we were speaking about the latest report from the NBS showing that 40% of Nigerians live below the poverty line. This is a report from September 2018 to October 2019. How do you react?
Well, very quickly, I mean, to save time, let me just make a number of points. The last time the National Bureau of Statistics came up with this study, what is called the Nigerian Living Standard Survey, was 10 years ago. And the critical difference between the report for 2018 and 2019 is that there is a change in methodology. The methodology used in this regard is, the sample size of in the states of about 22,107 households. But as is the case in many parts of the world, what is measured now is consumption rather than income, because income figures may not be quite reliable. So what you find by using consumption, there is, greater reliability in terms of data. And for you to be able to do that successfully, what the NBS did is to create a national poverty line, aggregate, which they put at, I think, about 137,000 per annum. If you don't end up to that, then, of course, it means that you are poor. And when you break it down per day, it comes to 376.5 a day. So what it means is that an average family that cannot spend up to 376.5 naira per day on basic food and non-food basics, like shelter, security, electricity, is adjudged to be poor. When you break all of that down further, you will see that it comes to about 97 cents. So the average Nigerian is living, below the dollar level.
Below.
So they say, the report says we have about 89.2 million Nigerians who are living in extreme poverty, which makes about 40.1%. But if you compare what has been released by the MBS to the global poverty clock, the global poverty clock says Nigerians who are living in extreme poverty are, in fact, over 102 million.
Yeah.
About 102 million.
Yeah.
So you see there's a difference, a significant difference between the two figures. But I think what accounts for that is the methodology. But a quick takeaways, and I hope that the governors, these various state governors, will take advantage of the breakdown in that report in terms of household, in terms of consumption patterns. Now, quickly, the report indicates very clearly that the more educated you are, the easier it will be for you to earn good living. At the level of the households, it's indicated that, look, if you have minimum of secondary school education, you are likely to do better than somebody who did not even have primary education. Yeah. If a household is led by women, households that are led by women, particularly educated women, tend to do better in terms of standard of living than the ones that are. So, for me, one takeaway from it is that education is important.
Absolutely, it's the
and
bedrock.
then the education of the girl child is also very important.
Absolutely,
so
bedrock
there are
again.
lessons, there are other lessons, there, but I think we should move on.
Let's certainly move on. Rota Sodiri joins us now to give us updates in the business world. Good morning, Rota. It's great to see you.
Good morning, Dr. Batsi. So the Abacha latest installment of the Abacha repatriated assets have been received. The Minister of Justice and Attorney General of the Federation, Abubakar Malami, confirmed this in a tweet yesterday. I think the full amount is $311,797,866 and about 11 cents is what came in. And of course, the three countries involved with the United States, Nigeria, and the Bailiwick of Jersey, the three nations that came together. The litigation process started in 2014, and then the process of the diplomatic process started or a diplomatic engagement started in 2018. And so what's going to happen now is that these funds are going to be transferred over to the central bank asset recovery designated account. This is part of a 2020 asset return agreement between the three countries. And then within 14 days from being transferred over to the central bank asset recovery designated account, it's going to be sent over to the National Sovereign Investment Authority. If you remember, President Buhari requested $150 million to be withdrawn from the stabilization account with the NSIA in order to augment FAC allocations for the states because oil prices had dripped by so much. And they have specific infrastructure projects which are supposed to be designated for the funds: the Lagos-Ibadan Expressway, the Abuja-Kano Road, and the Second Niger Bridge. So those are what has been allocated. Also, and I think this is part of what the agreement that was made with the U.S. and Jersey. The government, they also announced that the government is in the process of establishing a project monitoring team that's supposed to oversee the implementation of these infrastructure projects, and that's part of it as well. Now, some did think that perhaps the funds would go back to replacing what was taken out of the stabilization fund to augment the FAC allocations and perhaps for future, because although oil prices rallied a bit yesterday, they were at $28 a barrel Brent, but they want to use these funds for infrastructure projects, which is welcome. So money's coming in, and I think they were the United States and the Bailiwick of Jersey were very, very, very adamant that these funds be transparently used for the public to see and then used for useful projects like infrastructure. So it's pretty good news. It's good news. Yeah.
Well, that was the agreement that was reached, and the Americans are insisting that should there be any breach of that agreement, there are clauses in the agreement that will be invoked. So the Nigerian government had committed itself to using it for infrastructure and, domiciling it with the Sovereign Investment Authority. Yeah. So there's no problem with that as long as that is done. Because the concern, when in 2018 we got $322 million as part of the Abacha loot from Switzerland, the concern among Nigerians was, you need to account for it. What did you do with it? But later we were told that that was used for poverty alleviation programs, social investment program. Now, the other part of it is this monitoring group that will be appointed. The Malami statement pointed out that it will be a civil society organization. Now, that civil society organization, who is going to choose that civil society organization? Yeah. I do not think that the authorities should unilaterally on their own identify a CSO that they think will be friendly or that they think will be compliant. I think they should involve the coalition of Nigerian CSOs because there is a coalition. Let them be the ones to decide, the ones among themselves that have the expertise to oversee this and monitor and provide oversight function.
Certainly, there are glitches there that have to be addressed because it's all great to have a project monitoring team, but the way it's implemented is certainly important for the oversight. Yeah.
Very much so.
Brutus, thank you for today's updates. We'll see you tomorrow. All right. We'll go on a very quick commercial break, and when we are back, Aaron Akerejola will be joining us for COVID-19 updates. Stay with us. Welcome back to the morning show here on Arise News. We're now joined by Aaron Akerejola for some global updates on COVID-19. Good morning, Aaron. How are you today?
Leila. Good morning, Doctor.
Good morning, Aaron.
Yeah, it's good to be here this morning. Let's get straight into the numbers. And when we look at the worldwide figure of the number of coronavirus cases, is actually risen to 3.5 million, 3,584,322. All right, that's the number right now. But I would like to visit into Africa because when you actually look at the African numbers, it's becoming a little bit worrisome. When you look at the top five, of course, Nigeria has actually got into the top five. South Africa still remains the country with the largest number of cases in Africa, with 7,220 of those cases. But when you look at the pattern of deaths, it becomes very worrisome because South Africa, even though they have the highest number, have just 138 deaths recorded, as against Egypt, who have 6,813, but 436 deaths. Right. Morocco have a significantly lower number with 5,053 cases recorded, 173 deaths, and Algeria with 4,648 with 465 deaths. Nigeria coming in fifth place, just have 93 deaths as of now. So you look at these numbers and you get worrisome for what is happening in Egypt and Algeria. They might not be the highest number of cases recorded in Africa, but they have the most number of deaths, which is really, really scary.
Do they have higher older populations by any chance than we do over here in Nigeria? Because that could also constitute to them having more deaths, because countries that have greater older populations are definitely going to see more deaths. That could be one reason.
Yeah, the demographics could account also for figures, as we have seen in Europe. But again, if you look at the numbers in Africa, the numbers still look like, they are not as high as what we have seen elsewhere, either in Asia or in Europe. And the question you want to ask is that, look, is enough testing being done in Africa? Do we have enough capacity to be able to track the seroprevalence of COVID-19 within the continent, given the various challenges that many of these countries face? I mean, look at Lagos here, for example. We've been commending Lagos State, the Lagos authorities. Only yesterday, the governor of Lagos State pointed out that, look, they have about 3,000 samples that they've not been able to test. And the reason they've not been able to test those samples is because in Lagos State, they seem to have run out of reagents, of kits, of testing kits. So those samples are there. They are not able, to take care of those samples. And they were saying, by the time they take a look at those 3,000 samples, we may see figures in Lagos rising again by maybe about 20%. And in many African countries, this is part of the experience. Although I see that WHO Africa and Africa Center for Disease Control, has been doing a lot of technical consultation in the last few weeks. And I hope that the cooperation, the collaboration, the sharing of knowledge will be to the advantage of African countries. The other conversation around Africa has been about alternative medicine. I read on the Africa Center for Disease Control that they are not ruling it out. But the thing, of course, is whether that is the science of it. Now that Madagascar has become a major exporter of herbal cure, that seems to have caused a lot of excitement in Africa. But I would like to see African countries be part of this search for a vaccine.
Certainly.
The African presence there is not established yet. But in terms of taking herbal cure there's a lot of excitement, particularly in sub-Saharan Africa.
Yeah.
Guinea-Bissau, Equatorial Guinea, Senegal, Democratic Republic of Congo, they are all importing herbal remedy from Madagascar.
Certainly, and one thing that definitely has to be studied more and more research has to go into is immunity as well, and differences in immune systems to see whether that's contributing. Aaron, thank you for today's update, and we'll see you tomorrow.